Live, live. Here we go. All right. Welcome, everyone. Thanks for joining us on this beautiful Tuesday evening. This is our first time being live on all three platforms at once. So that's a pretty big deal. No, Zank, we didn't mess up Facebook. We're up on all three. Just took me a little longer to navigate it than what I had anticipated. So sorry for the delay, but thank you all for joining us. I'm Dr. Callan Stittelberg from Trillium Spinal Care, located right here in Rochester, Minnesota. And it is a gorgeous day and start to a gorgeous evening out there. So we really appreciate you taking the time to listen and join us. As per usual, make sure to share the video. Let us know that you shared the video, and then you'll get entered to win some Chocolate Shoppe gift cards. The Chocolate Shoppe gift cards, of course, are from Mantorville Chocolate Shoppe here in Minnesota, and they're incredible chocolate. It's all hand-dipped and made the homemade, the old-fashioned way, and they'll send them to anywhere in the U.S., for sure in the continental U.S., and then overseas to different places, and there's always a no-melt guarantee, so your chocolate's going to come the way that it's supposed to. And so make sure and share, that way you can get one of the 4 gift cards. And of course, we'll draw 4 winners today. So stay tuned to the end for that. So without further ado, we'll get right into it. We'll talk about, like I said, we'll talk about hypertension. We'll talk about high blood pressure, same thing. That also is related to the autonomic nervous system. So we'll touch on that just a little bit and talk about some of the importance with it. Most people who are familiar with NUCCA or upper cervical chiropractic care, or even other just, general chiropractic, are familiar with a study that was done back in 2007 in Chicago by a NUCCA doctor there named Dr. Marshall Dickholtz Sr., who's now, has since passed away. But he was an incredible doctor, a pioneer for the NUCCA profession. But it's really cool once you actually learn about how it all came to be, how this really, really neat study came to be. It's really cool to see some of the details involved. And so that's what we want to touch on here today, or tonight, is looking at some of the details that led this study to come to be. After we're done with the health talk here, you can check it out. It was on like Good Morning America and some other, national news outlets shared about the study and talked about, the likelihood that, this, or talked about, the importance of this and shared it so that more people knew about the upper cervical correction, the NUCCA correction, and like I said, how it can help with hypertension and high blood pressure. So just a little background, Dr. Dickholtz Sr. had practiced in Chicago for over 50 years. He formed a kind of a mutually respected sort of relationship with an MD there in Chicago, and over a period of 50 some odd years, this medical doctor had referred over 6,000 patients to Dr. Dickholtz in Chicago. And so they were looking at all sorts of different things. They'd come up with at least 32 different symptomatic changes of the autonomic nervous system post NUCCA adjustment, meaning after the NUCCA adjustment, they documented at least 32 different changes, not in any one patient, but in a bunch of different patients over a time frame. They found 32 different changes of the function after the correction, and those were all related to the autonomic nervous system. So the idea was then let's measure one change of this autonomic nervous system, and let's come up with a pilot study for it. So what they did is they found 50 patients who had to fit a very specific criteria. They had to have level 1 hypertension, which is, not as dangerous as, say like level 2 or 3 or 4, something like that. So the idea was the patient would have to come off of their hypertension medication for 2 weeks prior to the study. They would have to be pain-free, because if they were pain-free and they had hypertension, you can't blame that high blood pressure on the pain. And so that was one of the first things that they wanted to do, was make sure that it wasn't, any of the critics out there would say, well, obviously you adjust them, you get them on a pain. Well, obviously the high blood pressure is going to come down. Well, they thought of that ahead of time and made sure that any of the patients that were involved were pain-free. So that's really a very interesting part of it. And we'll go into a little further detail later on, but that just shows another side note. Common for people to think that chiropractic care can, it's there to help manage pain. Now, don't get me wrong, does a really nice job of reducing pain in all sorts of different ways. But it's also very important to recognize that the autonomic nervous system, the actual function of the body, improves when you have it corrected, when you change that position of that top bone. So, like I said, they did it with the NUCCA adjustment. They made sure that they were pain-free. So this was just a test of the autonomic nervous system and the change of the autonomic nervous system. The autonomic nervous system is essentially things that the body is controlling without you consciously thinking about it. So things like blood pressure, digestion, any of these different secretions of organs, communication to the organs, breathing rate, heart rate, all these different things. There's lots of them are controlled without us ever thinking about it. So that's the autonomic nervous system. So like I said, this is a simple way to be able to measure a change in the autonomic nervous system. So that's what they did. They adjusted. It's also very interesting. It was a pilot study, so you had 50 patients who all fit this criteria. Like I said, pain-free, stage 1 or level 1 hypertension, but 25 of them got a very specific NUCCA adjustment based on the NUCCA x-rays and based on the structure being off of neutral. 25 other ones got a sham or a placebo adjustment, not a real adjustment. You may wonder, how on earth is that possible to give a fake adjustment? Well, for those of you who've had NUCCA care before, it's extremely gentle. So the patient was led to believe that they were going to get adjusted. The doctor obviously knew if he was adjusting or not, but the nurse who took the blood pressure pre and post had no idea. And neither did any of the people that were involved in the actual process. The only one that knew was the doctor himself, who was actually doing the adjustment, because of course he had to analyze the x-rays and come up with a listing and then do the actual adjustment. So he was the only one that knew. So in the case of the measurer and the patient, it was a double-blinded study. So I mean, that's the highest tier of trial that you could do. Very difficult to be able to do with chiropractic care, but with the NUCCA technique, because our adjustment is so gentle, you can do it, and that's pretty darn awesome. It's also cool to note there's basically an SF36 or a RAND 36. It measures all sorts of different like well-being, so like mental well-being, emotional well-being, physical well-being. There's basically 8 different categories of it. Everyone of all 25 patients that were involved in the study, they all saw their SF36 improve from there to 8 weeks into care when they did the recheck, which is really neat. Now, as far as the actual changes of the blood pressure, like I said, 25 got the adjustment. What they found was 15 of them had an average systolic blood pressure change of 28 millimeters of mercury, which is incredible. That's a lot. The other interesting part of it, though, is that the other 10 that were in the treatment group basically had a statistically insignificant change in blood pressure. So it's kind of interesting. Of course, it warranted more research. Why 15 would have this incredible drop and 10 really didn't change much at all. So, it's important to have transparency and say, look, it's not like it's a guarantee for everybody, but the vast majority had good changes, and in the ones that didn't, they still saw the improvement in their overall health and well-being. So there are benefits there. It just, for whatever reason, the hypertension didn't respond. So the body's a tricky thing. So it's important to recognize that sort of stuff. Then there's something else I was going to talk about. I don't remember what it was. So the next thing is, obviously, this is a groundbreaking study. And like I said, it was done in a way that critics would have a very difficult time finding flaws within it. Of course, there's always flaws to any study, but this was done with a lot of forethought and it was done the right way. So definitely a really good study. What they clearly wanted to know is, hey, why did these 10 patients not respond? Why did these other 15 get just, incredible drop? Of course, you have to study that further. So the National Institute of Health gave a grant to my alma mater, Palmer College of Chiropractic, to perform a 3-year study on patients with hypertension, kind of a very similar way that they wanted to do it with this original pilot study. But the idea was it had to be done at Palmer for 3 years. Palmer agreed to it, took a bunch of funding from the NIH, National Institute of Health, and then they ran into an issue that they had to find a board-certified NUCCA doctor who was willing to essentially uproot their practice, move to Davenport, Iowa, beautiful Davenport, Iowa, and live there for 3 years and only treat patients on campus. So there's some stipulations, and they kind of had some issues finding a NUCCA doctor to do that. It ended up not really working out. So what they did is they used a different technique to try and replicate the same study results. And they did use an upper cervical technique, which is good, but it was a different one. And we won't go into detail about the one that it was or anything of that nature. But the importance of specificity, the technique that they used did not use pre and post x-ray, did not use the pre and post adjustment x-rays. So they were accomplishing something else than what the NUCCA adjustment accomplishes. That's not dogging on anybody else. That's just saying how it happened. So they did it. The results were not comparable. And so it essentially ended up being a very large study that was then kind of scrapped, unfortunately. So, but like I said, very cool that they did the initial pilot study. It'd be really neat to try and find a way to, to replicate it. It wouldn't necessarily have to be on hypertension, but another form of another system that is governed by the autonomic nervous system would be really neat, because if you can show changes of the autonomic nervous system without having to focus on just the benefits of pain care, that shows just how important it is and why it's important to talk about the neuromusculoskeletal system, not just the musculoskeletal system. The neuro is important because the nervous system controls the function. And if you correct the nervous system, if you change that position in the top part, you can improve the function, which is evidence here in this pilot study. Obviously, 50 randomized patients, but it's better. It's a very, very good start, and it should be further researched. So, if you're an MD out there and you're looking for some cool, research to get into, we could probably help you get going on that. So, of course, if you have any questions, hey, what's up, Dr. Oram? If you have any questions or you want any more information on this, make sure and let us know. Be happy to go into more detail or share the study with you. Like I said, check it out on, you can look it up on like NUCCA hypertension study. You can see it being shown on like Good Morning America, which, like I said, that's national news, which is pretty darn awesome. Next month, our health talk will be on allergies. So make sure and tune in for that. And like I said, share any of the streams and let us know, comment, let us know that you shared it, and we'll make sure to get you entered in to win some chocolate. And Carpora Cairo, what's up, Joey? Jordan, thanks for joining us. Mountain Views, awesome. Appreciate you guys joining. Jose, good to have you, bud. So we've got four Chocolate Shoppe gift cards to give away. Like I said, share it so you can also win one yourself. Holy smokes. Dr. Oram, 2 in a row. Congrats there, sir. Appreciate you keeping on sharing there. Bonnie Efforts. I think this is 2 in a row as well. Oh man, we might have to draw a couple extra here. Or maybe I got to dig further into the bag. I don't know what I'm doing it. Here we go. Amy Holiday, thank you for sharing. That's a first. And Amy's out there in South Carolina, so that'll be pretty cool. You can get chocolate sent all the way to South Carolina. Okay. Jennifer Unruh. Thanks for sharing, Jennifer. We'll make sure and get you a Chocolate Shoppe gift card in the mail. There, now we're getting some different names. I guess I just gotta dig a little deeper, you know. Andrea Eichhoff. Thanks for sharing, Andrea. We'll get you some chocolate here, or we'll get you a gift card for some chocolate. And battery's running low. That's not a good sign. Well, might be heading out there, YouTube. And Jen Rain, congratulations. All right, like I said, make sure and like, share, comment. Let us know that you did share it, so you get entered to win. And we'll see you next time. Happy Tuesday, everybody. Thanks for joining us. And this monumental evening when we're streaming on all 3 platforms at once.